Welcome everyone. We'll begin shortly. We're just having a few people trickle in still. Let's give it like about a minute or two. Luke, did you want me to drop those in the chat? Those surveys?
Did you want to wait till we kick off?
Yeah, because when people come in, you know what? Hold on, let me see if I can.
Can we also put the PowerPoint in the chat when we get to that point as well?
The PowerPoint, it's pretty large file. We may just want to. Can we just share it, or do you want to share it, or just have people open it?
Well, sure. Whichever you all are the experts. The only slide that I really wanted to share was the one that went over the president's vision.
Okay, I could have that.
Welcome everyone. Appreciate you all being here. See my esteemed colleagues on the screen. It looks like we've got about 15 people. Luke and Caesar, I'm gonna defer to you all whether we should just go ahead and get into it or.
Yeah, let's go ahead and get into it.
Okay. Well, again, thank you all for being here. I wanted to do a follow-up to the convocation presentation, and we'll get into that. But before we get into the convocation presentation, these weekly webinars have been so helpful to provide a platform for our wonderful City College family members to bring forth concerns, ideas. I learned a lot. And speaking of learning a lot, on Monday, when I arrived to campus, I went to our acting vice president of students, and we walked the campus and had a chance to connect with a number of our City College family members in offices like financial aid, admission and records. And then on Wednesday, Tilly and I went to the library and over to athletics, and we learned a lot, folks. We learned a lot, and I want to commend those of you who will continue to help our students, whether you're doing so in person or whether you're doing so remotely. Both are necessary. And so Caesar or Luke are going to drop some surveys in the chat because there are a lot of discussions going on about the Delta variant and whether or not it is in fact safe for us to be helping students on campus. I also acknowledge that a lot of people who have not been on campus and those who have been on campus have very real anxiety over being on campus, being around other people. That anxiety is real. I share in that anxiety, and we want to hear from you in terms of what we can do to continue to make you feel safe, make you feel cared for. We have a challenge before us, and that is, if you look at the survey that's going to be dropped into the chat, about half of our students say they want to be supported remotely. About the other half approximately say they want to be supported in person. There's ongoing dialogue on campus around this notion of parity. Why does this group have to return versus another group? Let me be clear that we've always maintained that our goal was to bring back between 20 and 25% of all services. Let me also say that offices in administrative services, offices in student services, offices in instruction, so both instructional faculty, non-instructional faculty, classified professionals, supervisors, managers, have been on campus throughout the pandemic. There is a narrative in our wonderful campus that is divisive in nature, that some are perpetuating this notion that there are more of one group on campus than another. I would challenge anyone who subscribes to that notion to join me in a walk of the campus. And what you will see in various places of the campus is our wonderful faculty. Ran into Terry teaching East Village high school students in a dance class on the A building patio. Ran into Professor Meehan, who raised her hand and said, I'm glad to see students in person. Can go down the litany of instructional faculty, the nursing faculty. Ran into Catherine. I think Catherine brought all the nursing students to get tacos yesterday. There was a line around the corner. So I mean, I could go down the list of our wonderful instructional faculty, upwards of about, I think the actual number is 19%, if I'm not mistaken, Tilly. Over 200 sections, either hybrid or in person. There are not 20% of classified professionals on campus. There just aren't at any given time, folks. They're just not. We have not brought back everyone. We don't intend to bring back everyone. No one is working 40 hours a week on campus. No one. I think Dottie would tell you that would not be smart to bring back 1,000 employees on campus for 40 hours a week in person. That has never been our desire. It has never been our desire to bring back 100% of any employee group. And so I must address this because I've seen a letter sent by select individuals, which I appreciate them sending because it allows me to know what the concerns are. But let me be clear, folks. There are no 100% of anyone on campus right now. Offices are working multiple shifts. Some people come in the morning, some people come in the evening, some people come on a Monday and a Wednesday, some people come on a Tuesday and Thursday. That's not 100%. Any given office is about 20%, about. And so I would challenge anyone who is putting out a counter narrative that one group is allowed to do something that another group is not allowed to do. Come join me on campus. Let's walk. I'll walk you to the classes where faculty are teaching. Caesar posted a wonderful video of the MS building. It was vibrant. It was live. Thank you to those who are volunteering to work the tents to help people show that they've been approved to be on campus, or helping them get to their class or financial aid or the bookstore. Through even when we weren't here, there were students on campus. Thank you to John Parker, Robbie, and others who set up the A building patios as a increased Wi-Fi capacity location. A letter or communication will be coming out of Marciano's office and John Parker's office. And we now know that we need to purchase some additional charging stations so that when students come on campus to access the Wi-Fi, that they could actually use that area. But it's been boosted up, strengthened power in those areas for students who can't go to a library or a Starbucks or don't have the means to pay for internet at home. We care about every single person who works at this college. We care about you. And if you don't feel cared about, please reach out. I want to hear, I want to understand. And I did learn some things. I saw some great things. DSPS, Bree and her team, her office is set up amazing. Lillian and her team, her office, ELP&S office set up amazing. We've got some work to do. I've gone on record asking John Parker to order plexiglass, not necessarily from the ceiling to the floor, folks, for every single person who has requested it. Because when I went into admission and records, one of our wonderful classified professionals in there said, Ricky, it's not about whether or not this plexiglass protects me from the virus. It's about my personal space. That struck me at my core. And so I asked John Parker to get every single person, if that is what is going to make you feel comfortable, folks, we will do our part. I also went into an office where someone had an amazing workstation, had a great camera, a stand-up desk, and I was impressed. And then I was defeated when I learned that this person had bought this out of their own pocket. We have these supplies on campus. Now, in this case, I asked the person to turn in the receipt. I called John Parker over to the office, said, John, make sure this person gets their money back. Now, that is not a license to go out there and buy something that you need or you want. That is to say that we are identifying places where we drop the ball for whatever reason. This is not a blame game. This is about getting people the things they need to support our students. And so I've asked Marciano to go to Costco, go buy some of these stand-up desks. What we're finding is that some of our vendors can't compete with Amazon and Costco. So if you think of large volumes, Costco and Amazon, they buy things by the tens of thousands, whereas some of our vendors that we're ordering from, when the things get in the port, they go straight to Walmart, they go straight to Costco, they go straight to Amazon, and our vendors are getting twos and fews of these things. And so I have cut out the red tape and told some of our managers, when they find out that employees need something, that they can go buy it with their own resources, get reimbursed, but they must have approval, right? Don't do that on your own. Reach out to your vice president, reach out to your supervisor. We're going to remove the excuses and make sure that we can get you the things that you need to be successful to serve our students. I'm going to say one other thing. When I was walking the campus, I had a chance to go into DSPS, and there was a student there, a disabled student, an older gentleman. And he gave me an earful about his challenges in this remote environment. Now, there is no question that some of our students are thriving remotely. There are an abundance of articles that say our most disproportionately impacted students are not thriving remotely. My daughter's one of them. I've got an 11-year-old daughter. She is a social butterfly. She despises remote learning, probably because I was trying to teach her a little bit, but that's a conversation for another day. I'm concerned equally about our students who have the technology, who have a computer, but also those who come to campus every day because they don't know how to get on a web portal to get an appointment or whatever they need to do. And so we're seeking ways, your innovative ways. You all have come up with so many innovative solutions, and I'm confident that we can come up with innovative solutions to serve our most disproportionately impacted students who don't have the technology. Even the survey that we posted, you had to have a computer and Wi-Fi to fill it out. So how are we getting accurate data if our students are coming to campus saying, I don't have a computer, I don't have Wi-Fi? And I saw your hand, John. Lastly, we are still issuing computers to students. Thanks to the folks in the library, Robbie and his team, John Parker and his team authorized another 200 Wi-Fi hubs. We want to hear from you if you have students who need computers. There is a backlog, but I'm going to authorize folks to go to Costco or Walmart and just buy computers. If students need computers to be successful, that's what we're going to do. We can't wait 6 months to get a student a computer and they're in a class right now. John Parker, you were going to say something.
Yeah, I just wanted to jump in. Thank you for just wanting to move things along and remove the red tape, as we all do. I would ask for those that are wanting to purchase items if they could check with the business office, with business services first, as we may have an inventory depending on what the item is, and there are also implications for asset tagging and inventory. If we're reimbursing folks, we have to asset tag and inventory these items, and it can prolong the process. So just check with us first, and we'll give the green light after that. It'll make the process a little easier.
Yeah, thank you, John. And I would echo, in addition to checking, well, really before they check with business services, they should check with their supervisor. Correct. And, we should have something in writing from business services and their supervisor authorizing the person to buy something. Now, there is a there is something else that you must know. Like when you buy something and we reimburse you, it belongs to the college, right? I mean, I think we all have to know that. But what I want to be able to do is that there are some people who have been waiting for things, who have requested things and have not received them. Now, if you requested something that we can't order, then we'll need to communicate with you. I've asked Tilly to reach back out to Robbie to double back to those folks who have placed orders that we have not received so that you can be communicated back to appropriately. We've got some gaps that we're shoring up, and I saw them for myself. We walked the campus with all of the vice presidents, and I believe that they were moved by some of the things that they learned as well. And here's what the last thing that we learned is that we'll come in here and we say, look, we have money to support you, but the resources are not getting to the people on the front line. I've asked them to work with and this is no one's fault, folks. I walked into an office where a person probably hadn't seen another person for a number of days, if not weeks. We got to check in on folks. We got to check, how are you doing? What do you need? Is there anything you need? And I'll end with this, and I know I've said it a couple of times now. When we walked around, what I encountered were very positive, happy people who just needed something realistic to help them do their job better. And I'm committed to being able to do that. The hot spots are here already. John Parker, hot spots?
Yeah, hot spots are here. We have approximately 300 that have already been dispersed. We have another 205 in inventory right now.
So let's clarify that for those that are watching. And these hotspots are for students.
Correct.
If you need a hotspot as an employee, that is a conversation with your supervisor. But in the case of students, if I am an instructor or over a program and I have a student who tells me they don't have internet at home, how quickly can we get that in the hands of the student and it be functional?
Is the question how quickly?
Yes.
I would say it would take more than a day or two, depends on the student's availability.
And it will be operational for the student to be able to use.
They're activated now, yes.
Okay, thank you. Other questions? I want to turn it over, certainly if any of my other esteemed panelists are here. Yes.
I do want to jump in on the hotspot because the only thing people have to be prepared on those is they're not charged. They're in a box, they're brand new, so you do need to take some time to charge. I thought I could use it right away, but need to get it charged up, those types of things. It does take a few minutes to get.
Can I also ask that our wonderful team here, probably led by Marciano's office or Robbie's office, can we have a webinar to show the students how to use it?
Sure.
So that we ran into this the first time, right? So let's make sure we create some resource to help the student be able to learn how to use it, so we don't just give a student something and expect that they know how to use it.
Great idea.
Other questions or other colleagues want to chime in?
Ricky, I see a question, and I realize that the attendees maybe can't see all the questions, so I'm just going to read it. I think this is one for me, maybe. What is the communication like and process for when someone who works in person gets a COVID positive test? So I'm going to assume that this question is asked that this is an employee that works in person. So obviously, if they find out and get such results, it's going to, what the pathway will be will depend on whether they are vaccinated or unvaccinated, meaning whether they quarantine or whether they just need to test again in 3 to 5 days. But I think what the question is actually getting at is chain of command and different things here in the campus and district. So that person would need to notify their manager, supervisor, dean, and that then goes to the appropriate vice president, and most importantly, to Karen Woods and/or Frank Fennessy in risk management, so that we can assure that everything is done correctly from an HR perspective and that the employee gets the support they need. And I am often looped in on some of those discussions to help assist with current CDC standards or contact tracing. And I hope that answers the question.
Thank you, Dottie. And we have had cases on campus this week. They have been contained to specific areas, and we're going to have cases. We had cases on campus when we were closed. It is a pandemic, and it is very, very real. Sandra, thank you, one of our great librarians. That is an excellent suggestion, that when we do the webinar for how to use the hotspots, that we record it and figure out a way to get it online so that people who can attend will be able to watch it. In terms of proper notification, if I could, Dottie and her team and the campus have had other cases of having to properly notify, mainly around tuberculosis. So we have experience of how to do contract tracing and the proper way to communicate with folks if we, in fact, I won't even say when we have these outbreaks. Folks, they occurred before COVID, they'll occur after COVID. COVID is with us. Forms of COVID have always been with us. Certainly this is the more severe variant that we've seen, but even notwithstanding COVID, we've had things like tuberculosis outbreaks that we've had to contend with. And for the most part, I've been very impressed with the way that we've handled these matters. Disease outbreaks are not a new thing. The level and the contagiousness of this variant is very real. One of the things that I was going to show, if I can share real quick, is that I'm very fortunate to sit on the board of Sharp Hospital. And so I get 3 or 4 weekly updates on the variant. And so what you see here is data, right? A lot of what we're hearing in the media and even in our offices, conversations amongst colleagues are not necessarily based on data. This report is just one of many reports that I receive weekly. Straight data in terms of the number of admits week to week, day to day, the percentage of increase. And if we can, I'll send this to Caesar so that he can put it in the chat. And I also sat this week, and correct me, Dottie, if I'm wrong, but at least monthly, the county health host a webinar for colleges and universities. So I sat on it
Twice a month. Yeah.
I sat on it 2 days ago. I'm sorry, it's Groundhog Day sometimes. So I sat on the call 2 days ago, and here is what we suspect. And I say suspect because there are a lot of things we know, and there are a lot equally, if not more, things we don't know. In some instances, this is like a bell curve. So it'll peak and then it'll plateau. And it is believed that the current variant that we're dealing with is going to peak about a month from now, largely because of the pending Labor Day holiday. That a lot of folks are going to go to the river, to the bay, amongst family, to restaurants, to the gas lamp, wherever your preferred place of hanging out. And a lot of people are not going to mask up. And so it's going to increase. And then it is believed, using high-level science, mathematics, it is believed that it is going to trend off around a month from now. What does that mean for us? We've used the word pivot throughout our planning. If we need to pivot entirely remotely, we will. We don't believe we need to do that today. Doesn't mean we won't need to do it tomorrow. we would not be bringing people to campus if we didn't believe that we were doing so in a safe manner. I want to acknowledge that those who are working remotely and those who are working in person are equally important to the success of our students. But I would say for those who are on campus, we tend to be serving the most disproportionately impacted students who don't have access to the resources. And I included in that are DSPS students who, frankly, we would be risking an Office of Civil Rights violation, even considering to not have in-person services. So, thank you to Bree and her team who have had to be here to support students through the Technology Center who need the technology that is only located there in order to complete their studies. Other questions in the group or my esteemed panelists, any other things you all want to chime in? I see Tilly, yes.
So thank you, Ricky. And yes, it was interesting, enlightening, learned a lot of lessons and things from yesterday and the walk around and just in general being here. And I forget because I've been coming back and forth for a while and forget what I was like when I first came back. And I've seen a couple of people in the last week, and all I can do is reassure them that the frustration they might have of the dust that's on their desk, the clearing up and trying to get back into the swing of it when you had it comfortable somewhere else. We felt that way a year and a half ago when I went home, right? I tried to clear a table to make sure I could get started for work a year and a half ago. So that was just one of the things I just kind of had to remind myself that people haven't been here and to be sensitive to those and help them walk through it. But then what really hit me yesterday was rather interesting was that I feel like we've shared so many things about different things, but yet maybe we haven't. And what I mean by that is the question came up and said, where are the public restrooms available on campus? And when we are sending everyone on the campus over to the A building to use the restrooms, that seems like it's a little far for certain places. So John and I and Marciano will work on a couple of things and come back with you all to have that maybe posted in better places, offer that. I think when we had the conversation with employees of restrooms, it was about their work environment. So totally for me, I overlooked of one of our students that's on campus, where do we direct them? So Luke, we'll make sure we get you the information for tomorrow and stuff, but I just want to acknowledge that today. May not really have more of an answer than I have right now, the A building, but we will definitely, I just wanted to acknowledge that piece of it, that we've talked about them. While your building may be open, that doesn't mean it's open to everyone at this moment. So I just kind of want to bring that up. And Ricky, I'm sure you want to follow up with that too.
Yeah, I ran into an employee, one of our city amazing classified professionals just a moment ago, and the bathroom was locked. And I could see a level of concern about it being locked. Kudos to Jay and his team. Facilities have been on campus throughout the pandemic. Folks, if something's not right, email Jay. He'll make it right. If you find a bathroom not open, please email facilities and we'll open it. Please email your supervisor, your manager. If I need to come open the bathroom for you, I'm on campus every day, just about. I'd love to have the honor to come open it for you. Security is a very real discussion, has been before the pandemic, will continue after the pandemic. And so we want to make sure that we can concentrate the bathrooms that are open and those that are closed. If it is a huge inconvenience for you to have to walk down a flight of stairs or up a flight of stairs, I want to go on record as saying, email your supervisor. I will personally sign off on you to have a key to the bathroom. I want to be able to do whatever necessary to make you comfortable. So, there's already everybody in San Diego already has a key to San Diego City College anyway. So heck, I will give everybody a bathroom key if in fact it is that much of an inconvenience to walk down a flight of stairs, or if the bathroom is further away from your office, I will commit to getting you a bathroom key, John Parker. Other things.
Thank you for the water.
So I see the question there. Why are the restrooms limited when we are trying to mitigate contact, yet we are all forced to share the same bathroom? Force is such a strong word for folks. What we are trying to do is, our facilities folks are extremely understaffed. And if we could do our part so that they can focus their attention on, if they had to clean every bathroom every hour, we'd have to triple the number of facility staff, which we don't have the budget for. Again, if you are someone who would like to use a restroom that is not communal in nature, reach out to your supervisor. I'm going on record of authorizing anyone who wants to have a bathroom key to get a bathroom key.
In the water, I saw a comment, and thank you, Tilly, for the reminder. We are delivering, as we speak, we might be done now, delivering water to various departments on campus. And I met a couple of facility folks, ran into them today, who are activating the bottle fillers, not the fountains. The fountains will remain capped and covered, but the bottle fillers are active today. The inside, indoor bottle fillers, not the outdoor bottle fillers. And they actually have filters on them, as you may or may not know. And any filters that need to be replaced are being replaced. Most of the filters that have, or the fillers that have been activated, have good filters on them. Like ours in a T building here, they said right outside our hallway, it's red, so we need a replacement, and they're working on that now. So if you haven't received your case, please send me an email of water. We will have city water containers that will be arriving next week for those who do not have any. So, and if you do, even if you do, if you want one, let us know. If I may add the plexiglass, you want me to pivot to plexiglass? This one, plexiglass, and doing our walkthrough with Ricky and the VPs. We requested another emergency fabrication for plexiglass. We will be getting those installed today for those areas that we walked. We are prioritizing other areas, higher traffic areas. So please be patient, but don't hesitate to send me an email if it's been a couple of days. Hey, John, when can you get to us? And we'll respond accordingly. But we're having 35 today that'll be fabricated and installed.
Yeah, thank you, Dottie, for responding to that one question. You know, I'm challenged to say what I'm going to say because I'm not sure, but it is my understanding that people's schedules are staggered in offices where there are large numbers of people. Certainly, if you're in an office that has 1 or 2 people, it may not even be a possibility to stagger it, lest the office not be open. This is where we said early on that I personally was not in favor of every office being open at the same time. While that may be ideal to a student knowing that an office would be open, it may not necessarily be ideal to the health and safety of an employee. So in terms of offices being deep cleaned and that sort of thing, folks, that's not necessarily how this virus works. What we know, and we've presented on this a number of times, is that the majority of our buildings, particularly those that we are using, have world-class filtration systems. We worked with Dottie, and she made a very sensible request because the health center is likely to have an increased likelihood of having people who are sick in it, that we have the resources for there to have extended resources. But we've had a number of presentations throughout the summer and the fall about the filtration system. We've had a number of people on campus throughout the pandemic. Not saying it won't happen, but we have yet to have a case where this virus was transferred from an employee or a student back and forth. Now, that may change, and it probably is likely to change. But some of the things that are being requested, we've actually researched. Now, certainly your offices should be cleaned, and if they're not, work with facilities, shoot them an email. I have the utmost respect for our facilities team. I'm sure that if you shot Jay an email and made a request, if it was a reasonable request, that it would get responded to. But know that facilities, we're just coming out of a hiring freeze. And so they're down a number of employees. So if we could do our part to support your colleagues, your wonderful classified professionals who happen to be some of the lowest paid employees on our campus, if you could support them by doing your part in your workspace, it would go a long way, folks.
Ricky, if I can add, in many places where I've worked, I believe here too, a lot of our facilities will not touch your desk without you being present. So I'm not sure, John, if that's something that works here or not. So if we can get a clarification on that, that might be helpful too for people.
And maybe we can invite Jay to the next.
Great idea.
Right, we're getting a lot of questions about facilities. Maybe we need to invite Angelo again about the filtration system, because here's the thing, we realize that more people are coming back that haven't been here in some time. And so that takes us reiterating some of the things that for those of us who have been on campus and we are familiar with, we probably need to reiterate some of these things. Leslie, I wanted to give you the floor to talk about mental health. You put something in the chat, but if you wouldn't mind, for those who may have missed it in the chat.
Sure, thanks, Dr. Shabazz. So we are happy to be back on campus. It's a mixture of excitement and anxiety, absolutely. But in the Student Health Center, staggering when health is here and when mental health is here. So somebody will be here 4 days a week to be able to answer questions, schedule students, answer the phone. Some of the things that we've had to modify in the work from home environment, and just wanting to be sure both sides of our house have been flooded with students, which is what we want. We know we're needed. So we're doing everything by appointment, and how we're seeing students is being determined a lot by the current status of the vaccine. So a lot of what we're doing remains remote. We are in the process of creating a Zoom room where students who are having trouble with accessibility or privacy will be able to come here and use a Zoom room privately and safely. And we'll keep you posted. We are always up for doing classroom presentations and department presentations to keep you posted on the latest. Our website is constantly being updated, but we are happy to be back and serving the campus community.
Thank you, Leslie. And I want to go back to the bathroom key thing to offer a further clarification. There are some offices that do have a bathroom key. There are some offices that don't have a bathroom key. If you're in an office with let's call it more than 3 people, I would ask for 1 key per office. If you're in an office where you're the only person, then of course it makes sense that you yourself have a bathroom key. And so please work with your supervisor, work with your dean, your vice president. The bathroom thing is real, and I want to make sure that people feel comfortable. And I absolutely support if you don't want to use a community bathroom. Now, I hope you can support that. Our facilities folks are vastly understaffed, and it's easier for them to keep that 1 bathroom clean than to have to clean every single bathroom on the campus. But if it will make your stay here better and you feel supported, that you have access to a bathroom that the public is not using, then I am in full support of that. Other questions are things you all would like to chime in on, the panelists?
So I did see a couple questions in there. I don't have them in front of me, or somebody can help me out on that. It's about spaces for students to go to, computers they might be able to use. Luke, I think there's a couple you might be able to help out with the registration pieces on that one, but I wanted just to address that we did go to the LRC yesterday, and they have plans for people coming in to use the computers on the 2nd floor of the library. sadly, John and I are going to work on getting some of that plexiglass in there because that's kind of one of our issues there as well. But there is spaces there for computers and printers, and someone else had great ideas to bring us, and even bring printers to the lobbies, to the upfront area, so we can have students utilize some of those. So we're working on that. I'm just going to have to get it as fast as we can to you. I'm also very careful with this right now for all the panelists, because we have processes in place where students are being checked for their vaccination status and or COVID testing when they come in for services. So those are other things. When we start to ask for that, we also have to have a protocol to make sure we're checking in, verifying, and that process. So if anybody has any great ideas on how to do that and improve it, please let us know. But it's not as simple as maybe sitting where you are at home saying, just open up that space and let them come in. I know it seems like it should be that simple, but it really has a lot more implications. But I do appreciate it. If people have identified spaces or know spaces that might work best, we're always open for any kind of what people might be thinking out there.
Yeah, speaking of what people are thinking, Marciano and I had an opportunity to chat on our walk. And a lot of folks are requesting, and I fully support, there being ongoing regular student services, all student services meetings. Being that we're remotely, I would ask Marciano, I think what would be realistic within the next 2 weeks, probably going to be on a Friday, that Marciano and his team should be able to do that. And then moving forward, I think that should be something that is commonplace. The other thing that we learned is that people have questions about how to ask a student about their vaccination status and whether you can or whether you cannot. And so I believe Marciano and his team are going to be working on a script for those areas. Marciano, you want to chime in on those areas?
Yeah, well, I'm happy to actually say that tomorrow Student Services is already having we have 2 sessions scheduled for tomorrow. I sent out a listserv invitation for folks to join us, thanks to the leadership of Leslie and Bree and Dottie, who helped us put together a toolkit for student services. So anyone in student services can join us. We'll also be recording the session so that folks would be able to view that at a later date. And the plan is to continue to have some ongoing training as things develop. One of the things that I love about the toolkit that was created is that it's as changes are being made to it, we'll be able to share that in real time. And so we're working on getting that out to everybody. Victor's put it on the website already. And we have our student services wide meeting today. As a matter of fact, we have our Student Services Council meeting today. So I'll be sharing more information with folks in those areas to go back to their teams and share. So there is a plan moving forward, but for folks for tomorrow, please check the email. There's 2 times that you can see the presentation. And there's been a lot of hard work from Student Services team to put into doing that. It includes scripts and includes different tools that you can use in addressing students and folks in our areas as they navigate this coming back to campus.
I have received a text question, if it's okay. It's not in the chat.
Any way they come in.
Yeah,
so questions.
Someone has texted me and said, I'm on campus currently right now. I'm here to get tested, do my COVID testing, but I can't find the location. It's because they're not here this week. It begins next week, the week of August 30th. And I believe John Marciano is going to be on Wednesday, Thursday.
As far as I know, it's Thursday.
Okay.
Just Thursday. There's
what room number?
It's M205, M206. Will be
M as in Marciano?
M as in Marciano, that is correct.
Because somebody typed in N as in nursing.
No,
so I think
M as in Mary, M as in Mercy.
And what room?
It is 205.
What time?
And we don't have the official time, but I believe it's going to be from between 9 and 5 is what we requested. We should be, we heard from HR this morning that there will be an official communication that will go out to students as well as staff who need to to test with all of the testing information. They're finalizing the information. There's a training tomorrow with Biocept to go through all the kind of final details. And then that information will go out to folks, letting them know how to test, who needs to test, how to upload tests if you're testing someplace out of that's not on our campus. It will include the schedule for all the other campuses, because each campus has different days for testing and different times. So there should be an opportunity for folks to test at one of our sites very easily. And of course, it's free.
And I just want to clarify, if I am an individual, how do I know if I need to be tested?
Great question. So you will get a notification first from the district letting you know that you are required to test. And again, the folks that are required to test is anyone that has an exemption on file for the vaccine, or anyone that is coming to campus to receive services for a scheduled appointment that's going to last 15 minutes or longer would need to do that. And it's really simple. There is the students and staff can sign up online for the appointments. If they're using the Biocept app, which is the company that we're using for the testing, there's an automatic QR code that they get when they are cleared to be on campus, that they can just show whoever it is that shows that they are clear. It has a date on it. And I know that I've already gotten this question, so I'm just going to get ahead of it, that says, how do I know that someone didn't screenshot it? Or how do I know that it's valid? It actually it's green when it's valid, and it'll turn red when it has expired. It expires after 7 days. And it has the date and the student's information or the person's name on it. So you'll be able to see who they are. So assuming that they've made an appointment, you'll be able to know that.
And thank you for clarifying, it's student and employees.
That's correct.
And employees, whether working remotely or working on campus, all employees need to make sure, if they're in those categories that VPSS Perez mentioned, needs to make sure by September 3rd, they have had their testing done for that next week coming up, and then input it into the system. Okay, I'm just asking again, because I thought I heard you say it that way, but I wanted to make sure. And so I hope the person that texted me got that information.
I wanted to add as well, just very recently, we added Wednesday as a test date from 8 to 2. So we'll have Wednesday and Thursday.
Okay.
There you go.
Same place.
Same place.
Any other questions from those of you who are watching? Great question, folks. We love the questions, because if you are wondering something, that means somebody else is wondering the same thing. So thanks those of you who had the courage to raise a question. Certainly thanks to the panelists who are working tirelessly to address things as they come up. We've got some continued work to do to make sure that you all know and feel that we care and are prepared to have you all on campus. We are taking the necessary steps. Speak up if you need something. Speak up if you see something. Speak up if you have some concerns that we could be doing something much better than we have been doing. We walked this campus, and I had an amazing time hearing from folks. Every single person suggested something because they care about this campus and they care about the students that we serve. And so I'm going to do everything in my power to hound our vice presidents to make sure that they get you the things that you need. That is so important to me, and I can tell you it's so important to them. We all learned something, and we won't go this long without doing this again. Tilly.
I would like to add to that too, Ricky. I mean, great. I don't mind you hounding me and following up and doing those things. That's great. But the other piece I would like to do is also just ask everyone out there that please let us know those needs, because I'll try to get around as much as I can on the campus. I know that might be easier. Please give me a call, send me whatever it might be, just because just because you submitted it, it might have gone someplace, and you know, it's just sitting someplace. We need to follow up and make sure we get you that webcam, maybe the Wi-Fi spot, whatever it might be. If you're waiting for it and it hasn't occurred, just please let us know so we can work on it again and we can do better. Yeah. So, but just let us know.
So, you know, there's a very legitimate question in the chat about returning to campus. And I appreciate this question because it allows me to remind us of the difference between equality and equity. Equality is everybody comes back, the same number of hours, the same number of days, the same number of employees in the office, the same budget, the same number of pencils, the same number of paper. That would be ideal. And I wish we had the same number of mental health counselors as we have general counselors. I wish we had the same number of nurses, Dottie, that we have other faculty on campus. I wish we had the same number of people in outreach that we do in admission and records. And I wish we had the same number of people in DSPS that we have in financial aid. But the reality is that is not the case on our campus or any other college campus on the planet. Every office is in a different situation. So equity says we look at those who can versus who cannot, and we make provisions. The other part of it is that these communications are coming out in writing and people are interpreting them. So the truth of the matter, and I appreciate the question, is that people interpreted the September 7th one way and people interpreted the August 16th one way. And we had varying interpretations. When we were made aware of it, best believe we reached out to those individuals who had neglected to notice, right? Because now we're talking union matters. In order to have someone return to campus who had not been to campus prior, they needed to be noticed. They needed to be noticed by 10 days. So there was an oversight or an interpretation by some people versus others. And we corrected that matter accordingly. Also in the letter from Vice Chancellor Smith, the word may is used. And anytime you use may, people have the right to interpret the use of that term may. And so I would just again remind us that it's a pandemic and everybody is doing their part, whether those people who are at home are working, just as the people who are on campus are working. The people who returned on the 16th, there were people who were here in June. There were people who were here in May, in April. Some people didn't have the liberty to return because they didn't have the liberty to leave. So what I'm saying is that they're on a campus as large as ours, 1,000 employees, 300 approximately full-time, over 1,000 sections. There are variations to what is occurring in all office spaces because equality was never in place just from a staffing and a budget standpoint. I hope that answers your question. I appreciate the question. Some people interpreted dates. Some people are still interpreting dates and communications, which is why we do this to try to clarify those interpretations. I'm glad someone asked this last question. So, and I would encourage this person, please email me, put my email in the chat. Marciano, are there counselors here?
Yes, they're exactly.
I don't know where these rumors come from that there are certain classifications of people who are not here. I met with 3 counselors just yesterday, no, 2 days ago on campus. So folks, please check your information, verify it. There are counselors on this campus just about every single day. It is imperative that we verify the information that we are being told. There are counselors on campus. There have been counselors on campus. I've met with Georgina on campus. Shall I tell, please, the person who emailed that, let's meet. Let me walk to you to where the counselors are. Maybe you don't know where they are. I would love to show you where they are and what counselors are on campus. Our counselors are doing an amazing job. Our counselors have been acknowledged at the state level for their innovation in helping our students. I am in contact, our wonderful dean over counseling, Dr. Nisa Savage, is working we have a wonderful chair, Georgina. Our counselors are doing amazing work. Bree, EOPNS. I mean, I can go down the list of counselors who are on this campus helping students or who are doing it remotely. So the notion that there are not counselors on campus is just not the truth. I'm sorry. There are people in every area that are not on campus. Let me also say that there are classified that are not on campus. There are faculty that are not on campus. There are managers that are not on campus because not 100% of the employees are here. That has never been our goal. Our goal has been between 20 and 25%. It would not make sense to bring everybody back at the same time, at the same number of days, the same number of hours. So the person who sent that, I would challenge you, come to my office. Let me give you a tour of the campus. Let me show you to where some counselors are, if in fact you don't see them, or if in fact you've been told that there are no counselors on this campus. That's just not true. I met with Bree, I met with Tyler. I could go down the list of the counselors that I've just met with on campus this week. Anything else anyone else wants to add? So in conclusion, sorry for those who have decided to share inaccurate information. Classified staff, our wonderful classified professionals, are not being asked to come back in any different way than faculty, or have already been back. Our goal has always been up to about between 20 and 25%. We're at about 19% across the board, folks. And so I know in times of challenges that it's easy to be divisive and to pit one category against another, but that's not the City College way, folks. That's not the wonderful college that I love. And if somebody would have come to Taco Tuesday or Taco Wednesday, you would have seen faculty, you would have seen classified professionals, you would have seen students, you would have seen administrators, and you would have seen supervisors. And so I invite anyone who continues to contribute to those fallacies and those inaccuracies, let's walk the campus. Meet me in my office. Let's walk the campus. I'd love to be able to show you who's actually here. Take care, everyone. Appreciate you all. Thank you, Luke and Caesar. Caesar, when we send this out, let's remind folks that the goal was always for there to be up to about 20 to 25% of people on campus in every classification. And that's pretty much what's happening. Take care, everyone. Thank you for everything you do for our college and our students.